very long to develop the ICS strategy. We looked at areas of work that we'd already got and things that we'd maybe already engaged upon, like we just had a big refresh of our health and wellbeing priorities. We had a lot of joint work, people are already working together, and so we pulled the ICS strategy together out of that. And then consuming my life at the moment is the development of the joint forward plan and trying to get that through all of our various trust boards for formal approval. Next slide, please, Debbie. The bit I always say to Debbie at this point is, although the focus you've got at the moment with Debbie is looking at the ICS strategies and seeing, do they reflect carers and carers' needs and what's going to be done to support and improve support for carers. We were lucky, not least due to Debbie, that in Surrey we had a very strong foundation already to draw on. So in the bottom right of this slide is the cover of the health and wellbeing strategy. So we agreed that strategy after a lot of engagement and a lot of thought. Formally that was agreed in 2019. It was reviewed and refreshed at the end of last year, and you'll be glad to know that carers were always in there from the start as a priority population. There is a list of about 12 groups there. I couldn't fit it all on the slide, but as carers was at the top, I thought I'd put that one in there. And this is recognition that you can't necessarily just do the same for everybody, otherwise you get more inequality. So it's recognising that we need to focus on our priority populations, of which carers are one, and others would include, for example, Gypsy, Roma, Traveller, all the groups that you probably have in your own areas. We have a carers strategy, and we have a lot of joint work. We have things already in train, like we have money, we have some budget which is given to the GPs to do carers breaks for individuals. We have Action for Carers as our organisation that are commissioned to provide a lot of our necessary support. And like everyone, we would estimate that the number of carers we have is roughly 1 in 10 of the population. The 2021 census put it slightly lower, but people may not always recognise themselves as carers when they are. So just like we've got the health and wellbeing strategy and those priorities, we have got our carers strategy. So when producing a joint forward plan, when producing an ICS strategy, we're building on really good foundations for carers that needs are recognised already, and that's really important. Next slide, please. So this may be a bit of an eyesight challenge depending on how big your screen is, but this is just an example page out of our integrated care strategy, and I included it because probably in too tiny writing for you to read, and definitely for me to read without my reading glasses on. I know that in the case study example, one of the things that we do when supporting individuals is look at their carers and their carers' needs and having a process in place to pick them up. And that's really important, because otherwise it's a bit hit and miss, isn't it, as to whether someone gets support because there's a great person there who recognises their needs, or whether there's just a bit of formalised prompt to ask the right questions. Next slide, Debbie, which I think is the last one. So the ICS strategy says what we've all agreed we need to focus on, and in our case we've got sort of 3 ambitions: about prevention, about delivering our care differently, together, joined up, and what we need to put in place to make that happen. But carers is absolutely in there, and I've put the page in there just to prove it. And it's been interesting doing the joint forward plan, because we asked people to provide a page or two and ended up with about 200 pages, which is way too long for anyone to wade through. So we have had to be ruthless in editing down to about 60 or so pages. I think integrated care strategies, probably because local authorities are better at shorter documents. The ICS strategy is a little bit shorter. But I've got that on the screen there, really just to give you a flavour of what we have going on and what we're expecting to have go on in the next couple of years, and we'll refresh this as time goes by. Debbie will have heard me say also that the ICS strategy and indeed the joint forward plan can't be all things to all men. It can't have the entirety of a carer strategy in there, but when you're doing your review, does it tell you that actually carers are identified as a priority? Does it give you some assurance that there are things in place, or there are plans for things in place? When you're on the other side of it, writing these things and then having people reviewing them and commenting, it can be slightly irksome. It feels like someone's writing marking the homework that you've written or whatever. I think by and large, because we spread our net so widely when asking for people's thoughts and contributions in the first place, most of the contributions we have actually seen as being helpful inputs. People pick up on things that we haven't noticed. We know NHS England doesn't have a formal assurance process on our joint forward plan, but we sent the second draft for comments. We will be sharing the final one. That's the end of the slide. You'll be glad to know, Debbie. And thank you very much, because it's so nice having your technical support there. And so I've tried to go through that really quickly, because I know you only had 10 minutes on the agenda. So Debbie, does that give you what you are hoping as a view from the other side and from outside London?
Sue, as always, it's really helpful to have you navigate us through the different layers of the cake. As I often say to colleagues, we have many strategies. It's how they all connect to each other, and I think you've explained that really well. But if you are willing, Sue, and I don't know if you can stay, but if anyone has any questions, I unfortunately, because I'm sharing screen, I can't see, so I'm going to ask my friend Janet to just let us know if there are any questions.
No questions so far.
There you go, Sue. Oh no, wait a moment.
Ismail.
Yeah, thank you. I just wanted to ask, in terms of the various partners, VCSE, health, social care, having the strategy in place is obviously the foundation, but in terms of the information sharing or understanding what one part of the group is doing as compared to the others, how do you think we can overcome the whole GDPR issue, and knowing that what the strategy does say is being adopted right across the board, if you like?
I suppose if I take it in reverse, finding out if what the strategy says is actually being delivered in practice, the question would be to ask about where is the delivery plan? What are the measurable outcomes that either have been agreed when the strategy was set, or maybe in a follow-on piece of work now to agree? And if there are some outcomes for carers, for example, that you think are particularly important, those might be some of the things to feed back. How many carers are registered with their GPs, and can you see that rising year on year? What sort of infrastructure is there in place for carers? Probably, I imagine it's mostly borough-based, but what do they actually have? Where would someone go for care and support? Where's this articulated? I think it's some of the real the tangible things that you want to see, not just fine words about, oh yes, we understand the importance of unpaid carers. And GDPR, I think it's a question sometimes of, you can achieve things if you ask people for their consent and they're happy to do it. So if someone, if a voluntary organisation or a healthcare professional asks the question, are you a carer? Do you look after someone who depends on you? And then it's with your permission, if you are happy, I'll share your contact details with somebody, so that if you have got support to signpost to, and I guess you've probably all got social prescribing in some shape or form, who ought again to be one of the sources of support to carers. So I think it's getting people to ask the question and ask the individual's permission there and then. Are you happy for me to provide your details onto X? If they don't want to do that, then the other way around is, here's the information for you about how to contact the carers support. But maybe it's more likely to happen perhaps if you positively, almost, it's like making a referral, isn't it? But you help the person on that first step of the journey. Does that answer what you were asking, Ismail?
It does, and I think it's an important thing you've raised in relation to the measurable outcomes, because I think one of the things that we really struggle with is there are so many different types of measurable outcomes that exist, say, within health, within social care, within the voluntary sector. And if that was nailed, if you like, there wouldn't be a need to worry about the GDPR issue, for argument's sake. So within the strategy, all those involved in having to adopt that strategy, if it was embedded that, right, the measurable outcomes we require is this, and then everyone was adhering to that, that's just going to make life so much easier by making sure that the information being pulled from whichever direction is actually all going to correlate, if you like. So in some respects, yeah.
Yeah, I think that's very true, and it is a huge piece of work which we've just been doing to try and get metrics for the joint forward plan as the delivery plan. And what we found is pretty much all of those metrics are there. They are being measured. They're not necessarily all brought together in quite one place. We're quite keen to try and get people during the course of the next few months to identify which ones do they see as the really important ones. But I think many of our measurable outcomes relate to our health and well-being priorities and strategy, which is why I'm saying almost when you're looking at the ICS strategies, bear in mind that you might need to kind of row upstream a bit to look at health and well-being strategies, and are they prioritising carers, and are they measuring things for carers? Is that okay?
Yep, thank you.
Looks like we got a question from Steve.
Yeah, so I don't know if I'm going to be articulating this right, but so
Steve, we can't hear you very well.
Oh, that's because I was eating my lunch and I had the microphone over my head. So I'm just going to ask a question. So is there a difference? Do people think there's a difference, and does it need to be articulated in strategies of unpaid carers as a group who may need additional support, like other cohorts that may need additional support, versus unpaid carers as a group that we need support in order to deliver an effective health and social care system? It doesn't. I hope that makes sense. And I don't think the latter gets enough attention. I think we often view unpaid carers as a group that need our support, when the reality is, if we didn't have unpaid carers, the whole health and social care system would fall apart.
That's a really good point, and you would hope the strategy would articulate both of those needs. Absolutely, the system would fall apart without that absolute army of unpaid carers doing what they do for family or perhaps even neighbours. And so, yes, it's both. This is probably the point at which I step out and leave you, Debbie, to go back to the main agenda. But that's a really good prompt, I think, for people's thinking, and when you're looking at the strategy.
Yeah, thank you, Sue. And Steve, I think, as Sue's articulated, it is a really important point. And just in my own observations of looking at the draft and interim integrated care strategies that the London systems have published, some have made you know, quite key statements about, you know, how important and how valued carers are to their systems, but then have gone on to talk about what their development plans are for services for carers. So I think you're right, they are two different things, but obviously connected together. Well, thank you very much, Sue Robertson. And now we're just, Janet and I, we're aware that we held a roundtable for colleagues from Carers Trust on the 11th of May. But of course, today we have our friends from local authorities joining us. So we just wanted to sort of explain to you what the process was around our intention around both meeting the national requirements to review these plans, and then what we intend to do regionally. So today obviously is the round table. You should have all received the spreadsheet that was reformulated with a few additional points that you fed back to us that you felt would be helpful in terms of regional intelligence. So today is our attempt to bring some of that soft intelligence together. We'll have a recording of this, which you'll be able to go back and access. And we will be producing a very limited and short report for the National Oversight Board for their meeting at the beginning of July. So that's where we are, but it is our intention to actually make the process very much about how we can really improve outcomes for carers across the London region. And to do that, we need your help and your support and your intelligence of what is happening at place. And we will, as a result of that, Janet and I will work up basically a London carers sort of state of care report, or like a stock take report, so that we can report right across a broad spectrum of carer activity to get a real feel between different boroughs, what is happening, what's innovative, what's exciting, and perhaps in other places what needs strengthening. And I think this comes back very much to what Ishmael was saying, is around how we join the dots. So some of the reporting will be around how we improve the governance and the accountability framework, where that sits, how the health and wellbeing boards relate to their systems, and perhaps most importantly, how as partners we're involved in these discussions. So that's where we are. Janet, did you want to say anything else?
I think you very ably covered it all there, Debbie.
Shall I hand to you now?
Cool, thank you. So just in terms of a reminder of the purpose of the integrated care system, so taken from the guidance, obviously the purpose of the system is bringing partner organisations together. So not only on paper, but also actually bringing people together. So hopefully some of those discussions about how that's worked in reality, we can bring out throughout today and later. With the four main aims around improving outcomes, tackling inequalities, enhancing productivity and value for money, and obviously helping the NHS support broader social and economic development. So there's areas to explore within that as well. Next slide, please. And then in terms of just around the discussions, obviously Sue highlighted some of those other different strategies and different papers. So what we're looking at, broadly speaking, today is the integrated care strategy, the one at the top, but also recognising there are those place level strategies and plans. So the joint forward plan, the health and wellbeing strategy, operational plans, the joint strategic needs assessments, and obviously joint local carer strategies. So it could be that if something isn't specifically referenced or mentioned within the integrated care strategy, there are elements within the other plans and strategies, and that's good for us to know as well, that we can feed into that. So whilst the focus of the review is about the integrated care strategy, some of the other elements may well come up in conversation, or maybe areas we need to explore further. So in terms of what we've done for reviewing the spreadsheet, in terms of the review criteria, if you want to go to the next slide, please, Debbie. There's a wealth of information and support, and I'm sure if, like me, you've kind of waded into some of these documents and then waded straight out again because some of them are quite meaty. There's lots and lots of paperwork, and it's really hard to keep on top of which ones we should be following where. So these were some of the review criteria that we were looking at in terms of the background to the spreadsheet and the background to today, to make sure that this is where people are meeting the criteria within the plans and the guidance and the strategies. Debbie, do you want to follow on from that one?
Yes, thank you so much, Janet, and hopefully that's given you all enough to sort of ponder on as we now move ourselves into the actual workshop roundtable discussion. So we've done a lot of talking to you, and it's we're going to be passing over to you. But really, I'm very aware that you will probably know what system, you know, where your place and borough is in terms of system, but you might not be so familiar with the wider London geography. So I've just popped this slide in here so that you're very clear with our 5 systems and our 33 boroughs. So hopefully that just gives you a bit of a breakdown if you're not from Northwest London, and you suddenly decide you want to know what's happening in Ealing, for example. Okay, so we've got 20 minutes now for each of these sections, and what we would like to do is to really invite you guys now to start contributing. We sent out the spreadsheet, so the first section is around what is your knowledge around the strategy, the integrated care strategy in your area, and are you aware whether it's been drafted or it's an interim or it's a final version? So who wants to be brave enough? I'm going to hand over to Janet because she can see you all. I can't see anyone. And who wants to be brave enough to talk about their system's integrated care strategy and what they've discovered? Now, don't all speak at once, or I'll have to pick on someone.
Oh, Graham. Go on, Graham.
Graham. Thank you, Graham.
Hello, good afternoon, everybody. Interesting enough, I think we very quick and dirty ask around. And in the Northeast London, I'm Graham Collins from the Carers Centre in Tower Hamlets. So we fit nicely in Northeast London, and looking at the questions, actually our strategy is still in draft form, so it's not completed yet, and we haven't actually had to, I think it's still at the ICB level, and speaking to colleagues in Northeast London, whether carers are included or not, we just don't know at the moment because it's still in draft. And carers, even though I think 1 or 2 people have had conversations with place-based, that hasn't filtered up. If I'm honest, I think when I speak to people, say for example in Tower Hamlets, it's all about, okay, well we've got a strategy here locally. This is what we're focusing on. And I think the ICS strategy is sort of a bit way off, it seems, at the moment for them. So carers are not necessarily being comprehensively built into this strategy at the moment, I don't think. Will they have their own chapter? Probably not. And care organisations haven't been engaged at this stage with the ICS. Again, I think each of us locally are trying to deal with the place-based, and that's where the discussions seem to be focused at the moment. So I think from the long and short of it is in Northeast London, it's not very engaged at the moment. Sorry to be a bit of a downer, but I think that's where we're at. And I think at the moment it feels to me it's everyone's focusing on the place-based, borough-based, to do their strategies, to do all that sort of thing. And I think that perhaps that will then hopefully feed up. But trying to get influence and shape what's happening for carers is quite difficult in North East London.
It's really, really helpful to have that, Graham. So do you have, in terms of Tower Hamlets, do you have your own joint carers strategy?
We do, yes. We have a carer strategy, which is an integrated, the old integrated commissioning approach, which is still in. So the strategy finishes this year. Actually, it's up to 23. They've just redone a new sort of strategy, which is waiting to be signed off at cabinet level. So that was supposed to be. Was it on Tower Hamlets? Yes. I think that was supposed to be signed off by next week, Carers Week. It's going to be launched at the Carer Centre, but we've been told there's a delay, so it's not happening.
And is it joint with health?
Yes, it was originally. It was a joint. It was a joint strategy, and it's a joint commissioning framework that we have in Tower Hamlets.
And it includes young carers?
Includes carers from 16 onwards.
Okay, so not sort of under 16. So
No,
what provision is made for them in Tower Hamlets, Graham? What strategy is for them?
That is all services provided in-house by the local authority, and the carer centre is providing support for 16 plus. So the support that's available for young carers is very much through the children's services in the social care.
Thank you. And that's a great starter from Graham from North East London. I'm wondering if anyone in part of the other 4 systems would like to now contribute. I can't see anyone, so Sue. Hello, Sue. I've just seen your name and hand go up. Sue, over to you, because you're South East London, aren't you?
Yeah, South East London. So I am in charge of Lewisham Carers Hub. I'm not sure how much is my lack of connection and how much the ICS lack of connection, but we've just gone through a tender process for our services in Lewisham, and that was on the back of developing an carers implementation plan, which was the commissioner was very keen not to call that a strategy. I'm not quite sure why, but it was very much driven by the local authority integrated commissioner, but very little involvement from health as far as I saw. And yeah, so that's out to tender at the moment, and it covered both adult and young carers.
And that commissioning intention was based on a Lewisham carers strategy?
Well, there wasn't really a Lewisham carers strategy. It was what they developed was a carers implementation plan, which was a strategy by any other name, but they were very keen not to call it a strategy.
Yeah,
so whether that was because it wasn't developed with health or whether it wasn't part of a more strategic approach, but it was a strategy, and it was based on consultation with carers, though I have to say it was very much on getting the numbers of carers involved and numbers of people, not just carers, just getting people to respond to a survey. They put a lot of effort into that, but actually the content of what the consultation involved wasn't very meaningful. So we got the numbers and the engagement, but actually what they engaged with wasn't as good as it could have been.
Yeah, thanks, Sue. And in terms of that engagement, are you aware through your networks in Lewisham whether there's been any engagement on the South East London integrated care strategy?
I don't know that, but I have only just been in place a year, and I have spent a lot of time over the last few months focusing on the tender, so I'm only just starting to get involved with the ICS, so it might be more my lack of involvement, and I know other people on the call might be able to say more about the South East ICS. I do have now a meeting put in with the place-based contact who's coming to see our service this month, but I haven't really put the feelers out there and tried to get involved, but certainly nobody's been proactive in contacting me at the Carers Hub to try and work with us at all.
Do you have a Lewisham Carers Partnership Board?
We
Well-
do, and our Health Watch team sit on that. We also have a carers partnership board that is chaired by a GP, so there's a health contact there, but we aren't allowed to be on that until the procurement exercise is finished. And so I get the impression it's only been probably in place for about 6 months, and I get the feeling that it's not really took off as yet. But as part of the new contract, if we won it, then we'd be driving that with the commissioner, the local authority commissioner, to really, make that a more meaningful forum.
That's really wonderful. Thank you, Sue. Really appreciate that insight. Did I see Ishmael come up again for North Central London?
Yeah, Debbie, it's really, really interesting stuff, this, because the irony is that where the Carers Hub in Islington have been working with the local authority, our commissioners, for about 6 months now in creating the new 5-year carer strategy for the borough. But in doing so, and obviously bear in mind that it's all in draft form, there is no mention or there's no indication of the integrated care strategy in relation to carers within that document thus far. Yes, we've obviously got some people involved from health, Whittington Hospital and others, UCLH, but I just find it ironic, being in this discussion, that you would think that any carer strategy, local carer strategy, would or should include some reference to a integrated care strategy for carers. So I'm actually quite interested to learn whether any other local provider, has got something that mentions the strategy within the overall carer strategy.
Thank you, Ishmael. That's incredibly helpful. Do we have anyone from Janet? I'm relying on you to help me with hands, but it'd be great to hear from someone from, I think it's Northwest London we haven't heard, and Southwest London. Can I leave you, Janet, to help me?
We've got a couple of hands up.
Fantastic.
So, Alyssa?
Hi, so I represent Health Watch on the ICS for Southwest London.
Oh, could you speak up a little bit?
Sorry, I think I have to peep this right next
Ah, great, thank you.
Yeah, so I represent Health Watch for the Southwest London ICS, and they've actually been quite good at including patients and carers in the creation of their two strategy documents, the Joint Forward Plan and the Integrated Care Strategy. So they're both still in draft form, but pretty advanced stages, nearly done, I'd say, and both of them do explicitly mention carers. So for the Integrated Care Strategy, there's 5 major priorities that are identified and 3 cross-cutting priorities. And elevating patient, carers, and the community voice, including co-production of improvement and design of services, and emphasizing their role in decision-making is listed as one of those cross-cutting priorities. So again, that's the integrated care strategy. When I look into the Joint Forward Plan, there's mention of carers throughout, including young carers explicitly. And the focus seems to be on offering them increased support for their mental and physical well-being, as well as making sure that carers have the information they need to help manage the patients they're looking after, especially patients who are being discharged from hospital or patients with complex conditions like diabetes.
Yeah, thank you, Alyssa. That's sounding to me that there is more detail in the Joint Forward Plan than perhaps in the Integrated Care Strategy, but really wonderful to hear that there has been engagement. That's something you're clearly telegraphing to us there. So yeah, that's very welcome. Do we have anyone from the Northwest London system on the call?
Hi, Debbie. Yeah, I think, is it only me? Or is there anyone else?
Harkeren. I don't know. Go for it, Harkeren.
Obviously, Debbie, as you know, with myself, I am completely new to these systems actually. So I've literally been working on the care aspect for only the last year. So I've had a quick look. We have one in draft, but it's going to the ICS board meeting on the 6th of June. So they want to launch that for Carers Week. So there is a draft up. I think some of the boroughs have done some engagement, but a lot of the engagement for, let's say, I come from Hounslow. So Hounslow and Hillingdon are due to start theirs next week. But I think from my understanding, from what I read on the draft, is very much around the health inequalities and maybe the accelerated projects in terms of mental health, inpatient, outpatient. I explicitly, I mean, I did skim read it because I didn't have time to read it in detail because I haven't done your spreadsheet yet. But in terms of the work within the public health, and we don't have a carer strategy here to bounce off on, so there isn't that. I would honestly say, in my opinion, there isn't that focus on carers. It's not explicitly in there. Whether they're included as part of the health inequalities, I mean, there is something in terms of gender, black and ethnic minorities when it comes to the health inequalities paragraph, as far as I remember, and young children, but it doesn't say young carers or carers per se, which I was quite disappointed when I read the draft, because I saw the older version, which was a link that I think you sent, Debbie, in with your email. But the draft, they're meeting on the 6th of June. And I looked it up for, the minutes that are circulated. I kind of got hold of it that way. Again, I'm still trying to make the connections and that integration, or should I say, knowing we've got a borough-based partnership and they kind of know that I'm working on the strategy. I will go to my ICP huddle mornings. They know my work around it. But similarly, probably what may not been happening, some what my other colleagues have said, is kind of like they're not filtering it down to the front line. They may report it on maybe a health and wellbeing board. They may have done some internalization sort of comms around it, but they've not really integrated the thoughts and processes of the people that are in the front line, or maybe a carers forum. We don't have a carers partnership board, so maybe that's where it's lacking slightly to give it the focus. And I'm trying to push on it as much as I can to just land it in Hounslow, but I'm trying.
No, that's really helpful. So I'm just going to, because we haven't got a huge amount of time, and we have heard now from all 5 systems. I'll just try and quickly wrap up, and you tell me if what I'm hearing is correct or not. But we're definitely hearing that the system integrated care strategies, none of them are in final format. They're mostly still in draft and interim stage. None of them have been particularly easy to find. I particularly pick up Harkeran's point there of finding information through papers, and that in itself is quite interesting observation, that you would have to know what you were looking for, I think, to find them. It's interesting also to hear a little bit about what has happened in terms of engagement and involvement with carers, and we're definitely hearing what feels like a deficit there. So that's a bit what my lovely friend Janet would say is the reality gap between what may be said in the strategy and what you're actually feeling. We're also hearing from you all that there is some mention of carers in the system strategy, but very little, if anything, on young carers. There doesn't seem to be any strategy where there's a chapter of their own in any of the systems. And I guess a mixed reception between some embedding of carers in strategies. So quite a bit there for us to consider. Before I move on to the next section, and Janet, just pick me up if anyone's got any hands raised. Actually, I'm just seeing Graham. You've got your hands raised.
And then I think Eglona, you might have put your hand up. I'm not sure if you had something as well. Graham?
Hello. Yeah, I just put it in the chat actually. I think it sounds like there's a lot of really good stuff going on at the local place-based, if I can speak, level, which is obviously stems from all the strategies that have been around for a long time. And I suppose, as I said, my worry is when will that be fed up to the ICP, or will we end up with a default position? Well, if it's happening at place-based, why do we leave it there?
Mm.
And actually, if we're talking at a macro level around population and that sort of thing, will there be an assumption that, well, that includes carers? So if strategy is being done locally, let's leave it there and let's not complicate it. Sorry if that sounds a bit clumsy,
No,
but
no,
my fear is that.
Okay, so is it a fear in terms of a risk, do you think, Graham?
It is. I think it's a risk in terms of, because we talk about population based, and I think, you know, we know that obviously, you know, carers have a huge role and a very valuable monetary, social, economical, rest of it value that they have. But will the ICB also say, well, the population, there's lots of different groups in the population, so we should be focused on the population and let the local place-based deal with the different aspects of that population.
Yeah, I hear
So
that.
that's why I see the risk.
And I think that goes back to what Haakon was just sharing with us, that the protected characteristics are coming through in some of these strategies, but they're not including specific mention to carers, which of course we know under the Equality Act come under section 13. So that's very helpful. Thank you, Graham. Janet, is there anyone else who
Yes, Iglona.
Oh, Iglona. Hello, Iglona.
Hiya. I'm just aware that South West London hadn't actually spoken, feels like the Eurovision, because I sent you through a whole load of information yesterday, and I'm aware that Rachel's on the call, because I think, and obviously the information I gave you yesterday was very much Wandsworth based, and my understanding is that Sutton and Richmond have been involved more fully than Wandsworth. Would you say so, Rachel?
In terms of ICS level, no. At place, yes, lots of activity. My understanding is at ICS level, Southwest London level, there's been no particular progress around the carers agenda in terms of naming or actions or leadership, strategic leadership at this point.
Yeah, I did get a named lead for carers. Yeah.
I think in theory there's named people that are there. I think the maybe the greatest progress that's been made is in terms of having voluntary and community sector as well as Health Watch representation and involvement, which obviously runs in parallel to looking at specific population groups, especially those that are experiencing inequalities. But my understanding is there is no particular activity of any type at Southwest London level. And I was going to just double check that with you as well, Iglona, to make sure your experience wasn't any different. So, you know, just kind of echoing Graham's point as well, that, you know, I do have some concerns that because there might be lots of individual pots of really positive activity and delivery, some long-standing positive partnerships, and I'd put Sutton in that, that might be considered to be sufficient. Whereas what's really lacking, I believe, is strategic oversight. And if we are going to be coming through again or continued, you know, cost pressures and so on, then that then can be a tension within the system where you have local aspirations and then the systemic realities and clamps. And then it's often down to carers themselves alongside of VCS partners to negotiate those tensions. And we certainly don't want that to be perpetuated.
Yeah, I did trawl through some of the papers yesterday for Southwest London, and it's interesting because again, it's certainly very much place-based. There's not a cohesive approach. And that, for instance, Merton and where else? Richmond, I think carers centres are key organisations, and in different places, carers for population of interest, and in Croydon, I think there's some mention of that as well. But it's sort of Wandsworth. We're not a key organisation, and carers aren't identified. So yeah.
Iglona, that's really interesting, and thank you so much for that little conversation with Rachel. I found that very stimulating. I find it also interesting that hearing from Alyssa earlier that from her point of view, the engagement with the Southwest London system has been you know evidence, whereas it seems that as carer centre services and providers, you don't well neither you or Rachel are feeling that. And I know, Rachel, you don't have a place-based partnership board yet, but Iglona, you certainly do. And it seems that would be a really good point for the ICS to come and engage on the strategy, but that's not happened as far as I'm aware. Are you aware of anything different, Iglona?
Steve.
Steve, yes, I know we've got Steve on the call. I don't know.
Steve's on the call as well. Yeah, I mean, it's difficult because I sent you over the responses as I got them from the deputy sort of yeah. I don't know. I mean, the argument could be, as I think was made in some of the answers I sent over, that because the Cares Partnership Board is something that's been in place for donkey's years. It's not something that's new. And health health co-chair it, and our funding comes from both health and social services. So I don't know, maybe they see that as job done. I don't know if Steve wants to comment.
I don't know, Steve. Janet, well,
we've got David Walker, who's got
David from Bromley. Hello, David. Yes. Good to have you on board.
Hi, Debbie. Hi, Janet. No, I think we've just to add a little bit to what everybody else is saying. I think certainly our sense in South East London is, I think some of us did engage with the ICS on a couple of occasions regarding the strategy, and we certainly pointed out the importance of carers. I think that's kind of hidden in their first priority, which is about prevention and well-being. The approach they've very much taken is, because carer strategies and statutory responsibility is the local authority level, they basically said devolve everything down to a place, and then said, well, yeah, it's their overarching. We know we've got the duty, but basically it's each borough's down to shape its own approach. So in Bromley, again, the local authorities being keen that it's seen to take the lead on developing both an adult and a young carers strategy. I've been trying to convince them to bring them both together. We are all part of the same place-based partnership called One Bromley, and the person who's leading the strategy from London Borough Bromley is actually a joint post between the local authority and health, but I think it's very clearly a local authority led approach, although I've been closely involved in that. What we've done separately to try and get wider purchase is to have a single carers charter for the whole borough that goes across the piece. So we're working to common principles, and that's being a useful way to try and engage with PCNs, with GPs, with others, with schools, amongst others, to try and look at more of a culture shift. And I think that's where we perceive, and from the feedback we've done from consultation, using our groups to talk about that, what we're hearing from carers, from young carers to older carers to those with people with dementia and others, is it's about the awareness on the ground, the signposting in the first instance, the actual recognition that someone's a carer. That seems to be it. I think it would help if we had something in the South East London care strategy that actually properly flagged carers specifically. But I think their take is that it's quite a top-down approach there. I think their take is that they've got so much to get in there that they can't really cover everything. So I think we just keep plugging on. The one thing I would say is that there's also, we have an independent, funded by the NHS, but a voluntary sector director called Tal Rosenweg. I don't know if you've come across her in South East London, that's covering the whole voluntary sector and looking to make sure there's full voluntary sector engagement with the ICS. So she's actually probably, in fact, I've just seen an email from her while I was on this call, she's probably my best day-to-day route to engage with the ICS from that perspective. So there's a reasonable amount going on, and there are points of contact. But I'd say, it's they've kind of decided what their priorities are at the top level, and frankly, I've seen very little movement in how those strategies being drafted since they first came up with principles, late last summer, frankly. They more or less said any detail goes down at the place.
Thank you very much, David. That there's a wealth of insight in that, and I think what I'm reading is what feels fragile is both the engagement and the connectivity between the place-based carer work and the system-based care work. Yeah. Janet, is there anyone else with a hand up?
No other hands up, so I think we're probably good to go on to the next one.
All right. Well, I mean, that was such a great discussion, and really thank you so much for speaking up. We're going to move into the next session, and then you'll be. I think we're planning our break at 2:10. So we probably might overlap a little bit here, but I'm wondering whether, considering some of the earlier feedback we've had, whether Section 2 on the NHS long-term plan commitment to carers is going to take us long. It doesn't sound particularly like it's been a strong point. So it's over to you, team. Who would like to speak about what they've managed to discover in the integrated care strategies around quality markers, carer passport, carer contingency planning, young carers, and really carers as a health inclusion group around the core 20+5? Is there anyone who's managed to winkle out some detail on this part?
Graham?
Hello, so me again. With Tower Hamlets, and talking about I think, and also covering the North East London. One thing it's not necessarily in the long-term plan, because I must admit I haven't delved through it. But one thing that is happening across North East London, because we have the ELF, or North East London Foundation Trust, or East London Foundation Trust, the Mental Health Trust, is that they do have a strategy for carers, and I sit on the board, that strategy board for that, which is great. And that has been in place for 3 or 4 years now, and that is really working with social care providers and also us in the voluntary sector. And also they have carers on there as well on that board, which is great. So, and they've developed a 3-year strategy for carers which covers Hackney, Newham, Tower Hamlets, and the city, and Barking and Dagenham. And what that does is that outlines what they've done quite well is that strategy outlines a mode of operation. So they have expectations at how professionals should be considering carers, dealing with carers, and making sure carers' voice is heard. So that's really good. So we have regular meetings, and we hold them to account. Okay, well, what are professionals doing about these modes of conduct, basically, which works well. So that's really positive. And from that, they are developing a carer's passport. There is a carer's passport in the Royal London Hospital, which is obviously not mental health, but it's still, the Royal London have got a carer's passport, which we in Tower Hamlets are helping to roll out. And obviously the Royal London Hospital does serve across the North East London, obviously a big major trauma hospital, etc. So it has many patients from across the footprint. So I think again it comes back to this sort of, whether it's being driven at a top level, we are seeing sort of local steps. And I think the stuff that's happening with the Mental Health Trust is really positive around that strategy, and that's being implemented and delivered. And the fact that the Royal London Hospital are rolling out a carer's passport and are seeking carers, providers like us, support to make sure it's the right approach. So that's really positive. So I see that a lot of positivity is in there. Whether it's sort of leading up into the ICS, who knows? But I imagine if it's happening at those sort of big health institutions, I assume it would be heard at the top. obviously it's dangerous to make assumptions. I realise.
It's what we can evidence, isn't it, Graham? I was just going to quickly ask in terms of that the trust carer strategy. Could you confirm whether that's inclusive of young carers?
No, it's only 18 on up 18.
Okay, thank you.
18 upwards.
Thank you, Graham, for that clarification. Over to you, Janice. Who else have we got?
Great, we've got Steve.
So I'm not, excuse me. So I'm not sure if I can comment too much on the different bits that are on the slide, but just as a general sense, and Aglona, please come in here as well. It feels like traditionally the engagement with NHS partners, apart from what used to be the CCG, which is now the ICB, has been quite difficult. So engaging with the hospitals hasn't been great, and engaging with the primary care networks hasn't been great. On a positive side, it feels like there has been a shift recently, and certainly in Wandsworth, where we, with the Wandsworth Carers Partnership Board, I think went a couple of years without having anybody from the acute trusts or the mental health trust being involved. Now suddenly it's like the buses, they all come at the same time. We have, I think, 3 or 4 reps now, three from the same organization, which is both a positive and a negative, but it feels like unpaid carers are rising the profile, or the profile of unpaid carers is increasing in the hospital settings. Probably less surprisingly, less so in Richmond, where we did have more engagement from the old CCG. We don't have that much engagement with the CCG now, but on a positive side, Kingston Hospital is doing some pretty amazing stuff with hospital discharge. So overall, it feels like the wind is at our backs. Yeah.
Yeah, thank you very much, Steve. Very, very helpful. So we've heard from South East and South West London. Are there any colleagues from North West, North Central, or North East London who would like to comment on whether there are including the NHS long-term plan commitment to carers in their integrated care strategies?
I speak for North East London, Debbie.
Thank you.
Not
oh
South
yes,
East.
sorry, North. Yes, you are. I do apologise.
You moved
So
across the river.
So we've got North Central, we've got North West, and who's the one I'm missing? So we've heard from 2, haven't we? So we've heard from North East and South West. Have we heard? Ah, yes, it's South East London. So Graham, thank you.
I've got nothing against that going south, but it's a lovely part of London. But I'll stay north. I'll stay north for this afternoon.
You'll stay north of the river. Thank you. I'm sensing that, and I'll defer to my co-chair Janet. I'm sensing there's not an awful lot more that people are reporting here in terms of the long-term plan carer objectives.
I would probably concur there.
Okay.
Yes, definitely.
Right. Well, let's just all take a short break. If we could reconvene at 20. Is it what? Let's have a look. If we can reconvene at 2:20, so you've got 8 minutes. So marathon run to make a cup of tea, visit the bathroom, have a jog around the lounge or whatever you're doing. And we'll see you then. And that section will be looking at health and care duties. Thank you so much. I'll stop presenting for 5 minutes. I'm going to grab some tea, Janet, and I'll be back in a minute.
Oh, you're on mute.
Apologies. I managed to grab a quick cup of tea.
Top mine up.
I'll get my slides back up. Right, here we go.
I got water, not tea.
Ah.
Good
Wow.
idea. I don't drink enough water.
Yeah, we all absolutely have to do that.
Unless you count it in the tea. I don't know.
Some really interesting comments in the first section of the round table there. Lots for us to build on, I think, is the answer. There's certainly going to be opportunities to strengthen.
Definitely.
I just get the impression, certainly local, well, for Wandsworth, I suppose, that, I mean, they really were, they didn't want me to have a place. But I just think it's, I don't know, I just don't think, I just think they're so far behind. I think they're really struggling. Is my sense, really, that, and it's a lot, isn't it?
Do you think that's because ICSs are still quite new, Iglona?
Yeah.
So that some of that structure is not yet really sort of cemented in, and those relationships are still quite new.
Yeah, and I thought it was really interesting, the presentation that Sue did at the beginning, because it just seems like they're really ahead of the game in terms of their whole sort of like planning process, maybe.
I think also, I mean, as you would have heard from Sue, she's been with Surrey for over 20 years. So I think, again, that sort of memory muscle, Iglona.
Yes, I have that.
It does. It does help, doesn't it? Poor juniors. Couple more minutes while people rejoin us. I'll have to revert to my lovely colleague Janet to let us know if people are rejoining.
Still a few to go, I think.
I've got to get my geography right, haven't I? Graham won't forgive me because I put him south of the river for a minute.
Well, I used to, before I moved jobs, I've lived in Tower Hamlets many years, but before I moved jobs, I was in Steve's patch in Richmond. I was chief executive of INS, Integrated Neurological Services, where we supported both the people in neuro condition and their carers. So I remember having interesting meetings with Steve. So yes, so I know Richmond and Wandsworth well. So Richmond and Wandsworth, are they still together, Glenn? The councils, are they still together? Richmond and Wandsworth?
Yes, they're happily, whatever the word is.
Happily married.
Started off as a shared staffing structure, was how they always described it, isn't it?
Yes, they never quite
separate governance.
That's it, yeah. That's good.
Okay, well, I make it to 20, so we'll let people drift back in as they're able to. Janet, is that okay?
Yeah, fine by me.
All right then. So by way of introduction, section 3 of the spreadsheet concentrated on the new duties that came in as part of the Health and Care Act 2022. So in terms of how this section has been broken up, we'd love to hear from you in terms of how carers have been involved in decision making and commissioning, how carers involved in discharge, how that's going. And I know many of you have worked with Janet and I in developing the toolkit, and how well that is landing in your particular patches. Love to hear about how your services are being supported through commissioning arrangements and funded through Better Care Fund. That's a little bit of a warm up, but you may have other things you'd like to talk to us about in terms of the Health and Care Act. The floor is all yours. And I'm trusting Graham, actually, because Graham's always at the front of the pack. Will lead the discussion on terms of the Health and Care Act for his patch, North East London.
Hello, is that an invitation, Debbie?
Yes, I'm afraid now we set a pattern, Graham. You're always going to be my first to speak.
Well, first, I think let's start off with all the positives. I think certainly in Tower Hamlets, in Newham, in Hackney, and other North East London boroughs, carers are involved quite heavily in the commissioning of services. So that carers' voice is placed there quite well, and they certainly. I know that certainly in Tower Hamlets and in Newham, the local authorities are very very keen to ensure that their carers have representation on forums when designing services and also when commissioning as well, particularly during the commissioning phase, which is really positive. And I know the Tower Hamlets who are just going out to commissioning the service at the moment this year. In fact, they've been working with carers over the last 6 months to find out, okay, well, what is it that carers want, and particularly around the area around hidden carers. So they've done, so certainly in Tower Hamlets, my patch, they're doing a lot of work around how do you engage carers who don't label themselves as such, and I think that's really important because that's, you know, we have such a large population. Many don't label themselves as carers because of cultural or just whatever. So that's really important. So that's happening, and also the as I mentioned earlier, the carers passport is being rolled out in Royal London, and also the discharge toolkit is also being implemented, which is great. And that's it's taken a little bit of time, but I think, you know, the Royal London is such a big hospital. We've got some champions there who are really supportive, and also I think what we've done at a place like the Royal London and at Elft is really make sure that carers are seen as a legitimate voice when it comes to designing services, but also to make sure that they can act as that critical friend. And I think that's been quite well received in terms of those services. So that's really good. And in terms of when we do carers needs assessments, some of the health implications are taken on board there as well. And that's certainly that support mechanism around carers, around assessments, is something that Tower Hamlets certainly takes very seriously. And I know Newham does in terms of its offer to carers to make sure carers' needs are being addressed. So overall, again, at a local level, the carers' voices are being heard. And from a statutory duty, you know, I don't always see it just as a tick box. Some of it is genuine, some of it is constructive, and it's not just because there's an Act in 22 that says they have to do it.
That's Gino, that's really uplifting to hear that, and it sounds like, you know, there's been some good progress there, and those relationships are beginning to be formed, and putting carers at the heart of everything we do is on its route for North East London. Janet, if we got anyone from any of the other 4 systems who might like to come in now and maybe share, you know, their experience of how the Health and Care Act duties and the Better Care Fund is being used in their patch.
Oh, Sue, go ahead, Sue, from South East London.
Yeah, well, in terms of carers' voices, we have a carers forum that we've had running now for the best part of a year, and the commissioner comes to that and delivers updates or asks questions or sends other people to consult on various topics. So from that point of view, I think that's working really well. That was an initiative really driven by us, but they've engaged with it, and we have somebody who sits on the carers forum who then liaises with the carer partnership board, which, as I say, at the moment we aren't on because we're in a procurement process, but we have somebody who is an advocate who sits on our carers forum and also on the carers partnership board and acts as that link. So updates us on the partnership board and updates the partnership board on discussions that we've had. So that works really well. As I said, the carers implementation plan, we did do a lot of consultation. We worked very closely with commissioners to consult on that. We had one very big event and then some smaller events, and we had some young carers consultation events as well. So carers are listened to. I do think there's probably still an element of tick boxing. Certainly with the adult carers, it was more about getting numbers than getting proper meaningful results and feedback. We have talked to carers about the hospital discharge toolkit, thanks to Debbie giving me a presentation that I did to everybody, and that's really given carers the confidence, I think, to, I know I only know of a couple of instances, but I know a couple of carers have said it gave them the confidence to speak up when they had their cared for person in hospital, and so I think it's being driven by the carers. I've little evidence of it being driven, or what's going on the other side, but that's more about my lack of knowledge of that. The other thing that's happening in our area, which is quite interesting and could be quite innovative, but isn't, is the Commissioner for our carer services is also Commissioner for the home care service, and they've just gone through a massive procurement of new home care services, and it's all packaged under something called Proud to Care, and we're all meant to be part of the Proud to Care family. And so they have carers interviewing on an interview panel for home care workers as a way of stopping the divide between paid and unpaid carers in the home. I'm not quite sure that's working as it could have done, but it was at least a way of trying to work more progressively. And yeah, I think carers really welcomed that, but the practical input of it isn't quite working as yet. And as far as the Better Care Fund, I'm not sure. We did get approached by our Young Carers Commissioner, because at the moment they were under two separate contracts, to say that they had £20,000 of health inequalities funding. They wanted to see what we could do for young carers, and we put a whole programme of workshops around stopping vaping and all sorts of different things that we could have done with that money, but we are yet to hear whether we've secured that or not. But it was health inequalities funding, which I'm guessing came from the Better Care Fund or something similar, but not yet as secured. The other interesting thing is in the new contract, when it comes out, is that the Commissioner put in there that we had to have a GP or a PCN lead, as well as a schools lead and a community engagement lead. So the way the tender was written was driving the strategy in a lot of ways. It wasn't, this is what we have the money for, tell us what you'd like to do. It was very prescriptive, some of which was very good, some of which was more questionable. I think that was probably about all.
No, huge amount of rich detail, Sue, from Lewisham, and much appreciated. And also very, very interesting to hear that you've been driving the carers and hospital discharge work in your patch, and yeah, a completely different approach. So interesting to see how that's bedding in. Thank you, Sue. So Graham and Sue.
And then we got Rachel from Southwest.
Oh, wait, Rachel, lovely.
I love that warm welcome. Thank you. I just wanted to kind of talk again, this is from a local perspective in London Borough Sutton, that we're going through a period of really thoughtful reflection. And I think quite a lot of systems leadership in terms of self-assessing, really quite honestly. There's not really been a problem in terms of carer funding and commissioning. That's been done in an integrated way. We're very fortunate to have had unbroken funding for both adult and young carers. We're on a 7-year cycle, so we've got time to plan and work together moving forward. And we're also really pleased that we've had our first kind of recurrent health funding at place for end-of-life care and the early stages of hospital discharge as well, although that's not recurrent at the moment. Also, too, Debbie, you'll know this, of course, and Janet, about the GPs and the PCNs. Well, GPs all now have a contract in Sutton around carers, which, yes, has some financial kickbacks off it. But I really think, you know, people are trying to work very hard in terms of identifying, recognizing carers and so on. And we're lucky that we've got health and wellbeing boards, with carer input strategies, where carers are not just mentioned as people in delivery of care and support or voices, but actually as partners in care. Where we struggle is a little bit around making that concrete in terms of delivery plans. And if I'm honest, my sense is that some of my colleagues get a bit overwhelmed when they try to work whole system, cross system. So very willing partnerships, very good conversations. But when it comes down to implementing things, by definition, some of our aspirations are a bit complicated, because mobilizing so many different parts of the system or re-steering them during difficult times can be a challenge. And then as a VCS partner, I do sometimes feel the weight of that on my shoulders as being the carer lead. And I know, for instance, some of the other CEOs and other boroughs are named as the carer lead, which is in great contrast to the presentation we had from Surrey and how they've been operating in terms of their systems leadership. So what I would say too is that a lot of this has been driven a bit by as well the adult social care assurance regime that's coming in, some of the self-assessment process. So what Sutton is also doing is refreshing our carer strategy. I think we'd say that we've been a bit of the poor cousin in terms of our neighbouring boroughs, in terms of the quality of our strategy. And as Debbie mentioned earlier, somehow post-COVID, we've regressed into a position where there's no strategic place where people meet to talk about carers issues, which includes meeting with carers themselves at the table. So where I'd say I've got the benefit of 10 years hindsight, 15 years hindsight, where carers were very much equal partners, that has regressed a bit in Sutton more recently. And I think as a carers organisation, I share responsibility for that. That's not just about other people hearing voices, it's about how we also organise ourselves and enable carers to have their voices heard and amplified. So yeah, I mean, I think I would just end by saying that the main issues that we've identified at the moment are mainly around delivery, around carers assessments, respite, reach inequalities, and some of the issues, some of the things in the 2022 legislation around contingency planning, I think are going to be a real challenge locally. I don't think people have a full understanding of what that means. And even things that, just backtracking a bit in terms of the long-term plan and some of the other aspirations for carers, we don't have things like carers passports rolled out in practice. So there's a few things there that we need to look at. But really, I think my ultimate issue is there isn't priority strategic carers leadership across the board in Sutton. And I think that's something that we need to tackle in order to get these things really kind of pushed into reality. I won't repeat though again, or no, maybe I will. I am concerned at South West London level that there isn't kind of priority carers leadership there as well. So that's a little tour around Sutton.
It's fabulous, Rachel. I could listen to you all day. It's so interesting.
I'm not sure my husband would agree.
Well, I'm enjoying your lupins back in the
or my staff for that matter. Yeah, that's a picture from PEI. Steve will recognize those from East Coast Canada, if I may add.
Thank you so much, Rachel. A huge amount of detail again for us to capture in that, and again feeling a little bit like there are some green shoots, but the lack of a strategic driven system level piece of work. So yeah, I'm hearing you. So have we heard from our colleagues in, I think it's Northwest London and North Central London? Those are the last two that it would be great to hear from in terms of the Health and Care Act and the Better Care Fund.
If I may, Debbie, it's Harkiran. I can.
Oh, thank you, Harkiran. No, lovely to hear from Hounslow.
Yes, well, from a perspective, Probably slightly similar. You probably heard some of this already, Debbie. So we, with regards to the carers discharge toolkit, I'm trying to get off that ground myself. I come from, again, just to remind everyone, public health background. My project is around obviously launching the carer strategy, which we don't have in Hounslow. So again, similar to what Rachel said possibly earlier from Sutton, is we don't have that strategic lead for directorship or someone that holds that responsibility, so they're accountable and they can probably push it from top down. It's all okay where we're trying to push it bottom level up, but you need to have that buy-in. We don't have a carers lead here in Hounslow. So with regards to the discharge toolkit, you'll be surprised to know, because you also sent me that lovely presentation. So I had to reconnect in from a local authority level with the manager for the discharge hub with our West Middlesex Hospital, which is in Hounslow. Quite nicely, actually, you also introduced me to G. So she's from the Chiltern West. So we're working together in terms of launching something. It hasn't hit off the ground in West Mid, but we are working on it. So it's kind of like I'm trying to get the buy-in with different places. Again, like you say, it's so I think somebody else said it quite well. It's mobilizing those links and networks. It's all right on paper and planning, but when it comes to actually doing, very little happens straight away. To be honest, it's like I feel like a snail. In terms of the engagement, we have done some engagement through myself over the last year. So we obviously, after COVID, we did used to have pre-COVID a carers partnership board, but that dwindled down because they weren't doing Zoom meetings, or the carers just fell. So the attendance in terms of representation of carers was quite poor. But we have done a Hounslow Borough-wide carers consultation. I held some one-to-one listening sessions, and obviously hearing what everybody else is saying, we actually offered in terms of one-to-one telephone calls at a time with Sue. I mean, I myself have done evening phone calls because I know how difficult it can be for carers and taking that time out. So rather than have a set focus group at a time, we made it as flexible as possible to hear as many voices that would then feed back as part of our engagement. And we will, there is vision of coming, obviously part of the strategy. One of the objectives would be obviously to set up something similarly like a carers partnership board or a carers partnership network. So that will go on. With regards to contingency planning, we already do, we call it the carers emergency card here in Hounslow. That's actually doing really, really well. But unfortunately, with the pressures on adult social care, you have to have a carers assessment to get a carers emergency card. So where they're probably struggling with higher priority support need assessments, that carers-led assessments and annual reviews haven't been doing so well in terms of the numbers when I've been monitoring them. So there is going to be a pickup on that. But we do have work going on a positive level for carers short breaks, respite, and also the strategy, which we should hopefully get done.
Thank you very much, Harkerim. And actually, from my perspective, you may feel like you're going at a snail's pace, but I actually think you're storming it in terms of how much you're delivering. You're a one-person team, and congratulations to you for the amazing work that you're doing. What about Janet? Because I can't see anyone, but it would be really good to hear from colleagues in North Central London. Which colleagues do we have in North Central London who would like to talk about Health and Care Act and the Better Care Fund and how that works?
I think we had Ismail. I think Ismail might have had to leave.
Okay. Do we still have Tiff on the call?
No, unfortunately.
Yeah, she's had to get.
Yeah.
I know.
Oh,
I know.
Rachel's got a hand up.
Okay. Thank you, Rachel. The floor's yours.
I just want to make sure I'm at the back of the queue for a further update, but just very briefly, the other thing I was just thinking about that I think needs some attention is the JSNA work. And I was hearing my public health colleague speaking there as well. We found it really difficult to get the mention of carers in the JSNA beyond there are X number of carers in Sutton according to the census. Even though there were pockets of information in, say, the Core 20 work or the great reports that are done by Carers UK and Carers Trust and others, there is more data out there. But harnessing some resource within our JSNA public health team to drill down on carers data was quite a challenge. And I think data is an issue full stop, because the flip side of that is, for instance, there is good practice taking place in areas of in parts of our system that, due to methodological reasons or machine reasons, it's just not getting recorded. So if it's not recorded, it can't be printed off and it can't be used. So I just wanted to kind of pop those issues in. The manifestation of that was that we are examining our BCF in quite some detail at the moment, as we should be, and there were numbers put across carer spend, but there was a struggle to actually extract what that money was being spent on and what outcomes had come off it in previous years. So there's something about understanding what we're doing and why that also needs to be strengthened as part of this work, both at place level as well as on a Southwest London level. So I just wanted to add that in.
I think you've raised a lot of really important points there, Rachel, and certainly in terms of BCF, most of you will know that the BCF assurance process, local authorities will be providing their spends and their narrative. I think they have to get them in by the 28th of June, and certainly I'm going to be working with the regional BCF manager to look at those and review those in the first 2 weeks of July. And I think Rachel, you make an important point about year-on-year comparisons, because I'm particularly interested to see how what the response has been around the Minister of State's letter to the DASs to look at carer break funding and to look at building capacity in that, and whether we can begin to see that through. I would agree with you, Rachel, that you know, when doing going through an assurance process, and certainly that's I welcome the opportunity to do that. I was involved last year across London, and we do spend between 28 and 29 million on carers services across London, but it's very interesting when you start drilling down, and of course the narratives that we get are very sort of high level. So one of the areas I'm particularly interested in is seeing, you know, around what is the support offered to young carers. So we're beginning to get some better data, but it's still very early days, and it is welcome that the Department of Health and Social Care have decided that we do need to have that focus on carers, and long may that reign. Sorry, I just disappeared on a tangent there, because Rachel and I could talk all afternoon. Janet, is there anyone else with their hands up who wants to talk about this particular section of integrated care strategies, or shall we take the opportunity to move on to section 4?
Probably worthwhile moving on. Just before we do, there's no hands up, but there's a couple of comments in the chat.
Oh, excellent.
Around, where are we? Eglona, so Wandsworth have had some money to operate hospital discharge project, as have Merton carers. Some of it's piecemeal, but trying to get a more systematic approach. Pushing at an open door. Yeah, a note from Emily around JSNA being really critical, because that's the place where needs are evaluated in terms of the ICS. So yeah, more focus on the data. And Verity's kindly reminded us there's the GPPS data at the ICS and PCN level, which is going to be published in July as well. So that's something for people to watch out for.
We're definitely looking forward to that data, aren't we? That GP patient survey data. Can I just on a personal note of interest, is anyone on the call aware of that their local authority public health team looking to refresh their JSNA based on the new data that has come forward on carers? Is there? Markarim, what a surprise, our public health guru.
I would.
That's another thing, is a big battle at the moment. Oh, sorry to talk across. It's a big battle at the moment, just in terms of resourcing. Yeah. So even though there's lots more data out there for the first time, like really juicy data.
Yeah, good data.
It is about trying to get people to prioritize carers. within that when there are so many other populations to be considered. That's just local.
So what I'm hearing, Rachel, is there no plans currently in Sutton to refresh that work?
The Royal We has requested it, and the response has been it's been done. But the question is the quality of that and whether that will be picked up further. So it's a live discussion, Debbie, is what I would say.
Thank you for that clarification. Hakurin.
Yeah, sorry, just to add, obviously following on from our work, I've done a real push on this with the JSNA actually, in terms of when, like you say, fact finding. Me starting off completely new, I literally just had to hunt around myself. So I went through all the publications myself. Obviously, you have the ASCOF and the SACE surveys, but in terms of our data was like, obviously before the 2021 was released, it was 2011. But in terms of the stuff on carers allowance, because you've got open publication on DWP data, System 1 and LAS. So I was literally, who are our carers? We didn't have anything. So we're coming from that push. In fact, over the last couple of months, I said, look, I've already got half your data for you. The census one, I'd already compared myself because we have the benefit in our public health in Hounslow. We actually have a data analyst of our own within our own team, so they can do a lot of like mini charts and graphs. I'm not great on data, but we've had a meeting with our JSNA team and they are going to refresh it. I mean, they were giving me 2025 as a date and I'm really pushed on it. So hopefully by the end, I'd say by July or September, a lot of it will be put through with the census stuff. Obviously, that's open publication, doing comparisons within age deprivation areas, comparing it also with the census age groups versus what we have on adult social care age groups in terms of primary support reason for carers. So there is a lot on. So that was probably the really positive one that I actually got out of this, and I can see it coming through quite quickly.
That's really encouraging to hear, Hakurin. I really appreciate you sharing that. Okay, Janet, and anyone else, or are we heading in for section 4?
I think let's go to section 4.
Oh, wonderful. Thank you, everyone. So this section is around people at the heart of care. Some of you will have seen that particular paper that I think originally it came out in December 21, didn't it? But it has been refreshed. And so what I'm interested in is hearing in terms of what your experience is at ground level, and remembering this is focusing very much on how this particular driver is working in terms of carers and the integrated care strategies. So let's have a little think now, because we are now beginning to get carer data from our system. So certainly I can share the fact that in Q4 we had Q3 data from 3 of our systems with an additional footnote from Southwest London that their insight team were working on their own carers dashboard. So from April. So effectively now we should be able to start drawing down on data from 4 of our systems. I won't name and shame the remaining system. What that would be really good to hear from your perspective, whether that data is being shared. The SACE data that Hakurin has just reported about, is that coming through and being used in terms of this strategy? Also, the other sections are whether we're using carer experience, carer stories and case studies. How are they influencing your system's work? So Sue's not here to tell you this, but I know in Surrey the process that we put in place was for a patient or carer story to start every board meeting, to just sort of really remind folk about you know what they're there for to do. So interested to hear about how carer stories are being used. Also, and I'm not sure if Alyssa's still with us, but also about Healthwatch and whether they're the work that they do around capturing carers' experiences feeding into this. And finally, again, we've had mention about the CQC assurance process for local authority and obviously for health providers. So interested to hear what you have managed to glean in terms of your own systems on those 4 particular areas. And not wanting to cement in that strategy of always going to Graham first, but I know Graham will have something to say about this, so I'm going to Graham first here. I hope he's smiling.
I am indeed. Just sort of working backwards, I think interestingly enough, the CQC lead in Tower Hamlets Council contacted me last week about how they want to make sure that the work around carers is being worked into the council. So I've got a meeting with him tomorrow to talk about what that would look like. So that's good. So at least, and I'm speaking from Tower Hamlets perspective here rather than North East London, but that's good news that we've got the meeting involved in tomorrow to talk about how we can make sure that carers engagement with the CQC preparation is meaningful. So that's good news. With regarding SNOMED codes, I think I attend a lot of the locality meetings, the primary care networks, localities, and they're often talking about the SNOMED codes. But I think again, you do get a sense sometimes it's used. They have a bit of a flurry when they remember to do it, and then suddenly something comes along and they perhaps forget to do it. But it's something that we often raise with GPs and healthcare professionals. So I think that is gaining traction. But as with all things, it needs constant reminder, doesn't it? Particularly with there's so much else going on. And in terms of Healthwatch care experience, we haven't been contacted by Healthwatch yet. So they haven't really been involved with our service. So that's been a bit silent on that front. And useful care experience and carer stories, I think that really comes through. Again, in Tower Hamlets only, there is a carers working group or carers partnership board, which has carers and other and providers, both from the voluntary sector and from health and social care. And when we have those forums, or those partnership boards as they're called now, carers' voices are certainly sought. And what they do quite well, certainly in Tower Hamlets, is think about, okay, well, what is the big thing that carers are struggling with at the moment, and what does that look like on the ground for a carer? So there was a particular concern for carers around mental health and being involved in the discharge of the cared for, and carers were presented what they were experiencing on the ground, which was at odds with what health and social care thought was happening. As always, there was, so that was a good learning point there. We're saying, well, the systems and processes are there, but actually, in reality, that's not happening. And why is that? And that was just really unpicking that. So it's, I think this is often a slow burn. These things are highlighted, then you have to go back through the systems and processes to find out which bits aren't working in a very complex, elongated approach. But I think from what I see, and we at the Carer Centre are very, very keen to make sure it continues, is that carers' voices are being heard and their stories are being heard. But it's just that practicality of what then. I think stories are being heard, but I suppose a lot of people on this call will say, and Rachel alluded to it earlier, actually, is that experience leading to change? And I think that is the ultimate goal we want. And I don't think that is the case always. I think it's a very slow burn, and carers get frustrated that they're often asked again a year later when they've already explained what the problem was, because the system takes so long to unpick.
It's very complex, isn't it? And some of it is cultures and behaviours and how you change culture. Somewhere I read a piece that a bit of research that says it takes about 10 years to change culture. Yeah. So that's very helpful to hear that.
but carers often come up with what are simple solutions.
Yes.
To complex,
Yes.
but sometimes they're simple problems, but they're okay. But they
Yes.
just don't understand why it takes so long to change something. Why,
Yes.
for example, is a carer not told when their care for is being discharged
Yes.
around mental health services? I and carers just can't get their head around why can't you phone them and say we're discharging, blah blah.
Yes.
And that isn't happening, for example. So
Yeah.
that is a real problem.
Yes.
But it's taking an age to sort out.
And I guess historically that would sort of sit in the sort of quality improvement portfolio, which is, for me, it's quite interesting to see where carers fit in that sort of work, and how that is accountability is fed up through both the provider arms and then at a systems level. And I'm not sure we have that penetration yet of that. No. Thank you, Graham. You've warmed us up very much on people at the heart of care. So, who next? Who would like to? North East London is almost on a full picture here. So let's hear from someone from the other systems. Over to you, Janet.
There's no other hands up as yet, but I'm sure people are itching to get to that button. Oh, Harkran. Northwest.
Northwest London.
Northwest
Wonderful.
London. I thought I'd get it out of the way. So I've been reluctant to speak. Okay, so I covered obviously some of the bits before, didn't I, with regards to the JSNA and the SAFE data that we're doing. I am trying to push with regards to the SNOMED codes. In fact, it was just a conversation we had yesterday, obviously with Carers Week, and we obviously got the URL where we're trying to promote everyone on our website to the events and activities that are going on. So I had a conversation with one of the PCNs. So we were looking like, how do you, it was very simple in terms of, I know it's a bit of an offshoot, and how do you design your text message? Do you do it by population or do you do it by SNOMED codes? So I was trying to explain to this comms person, well, actually, you don't want to just target carers, because you wouldn't want to open it up to the population by age, because I want to identify hidden carers. They may be an adult, so not. And then when she looked at the SNOMED codes, it wasn't the three, should I say, it wasn't the 3 or 4 we've agreed. There was about loads. So it's a slow practice. And from her working at one PCN, one surgery, she goes, oh yeah, I do remember some guidance or a newsletter coming through.
Good.
But I don't know where it's gone. So I was like, it's probably another piece of work with my link with primary care at some point, but I have parked it, but it is something that I will look at once I've delivered everything else on the JSNA, because that's something that's really good. Carers stories, carers experiences, similar to, was it Graham? Sorry, yes, just before. I heard something similar. Like I said, we've done the engagement and we were thinking, well, we'd like some testimonies to put out there. What is it life like for a carer? Somebody could resonate. So in terms of what I want to deliver is comms around public health, in terms of making people aware that actually I might not identify myself as a carer, but I could be a carer, but hearing a similar story and a young carer story. When I was doing the engagement, they're like, oh, I was asked all of this back in 2017. Where did it go? And similarly, when you're looking at changing processes, I hear the same story. We were asked all this. I'm sure I'd done something 4 or 5 years ago. Where did that go? And I'm like, I don't know. That's like pre my time. But I'm hopefully for Carers Week, we have got our lead member for health and social care doing a short launch video for Hounslow. For launching of Carers Week, and part of that I have encouraged our comms team for her to put an ask out, encouraging carers to come back with feedback on how well it went, and also for their testimonies and what life is like for a carer. So if I've got her backing from a member now at the moment, the plan is, what I have designed is maybe not all at once for Carers Week, but like you said, that regularity, maybe once a month, just have our comms team put something out and say, I mean, meetings is a really good idea. I did think of that actually, carer story just before a meeting. Maybe something I can start off, but yeah, I'm building on it now.
No, that's really wonderful, and it's sort of resonating with what Graham said, is that you know, particularly on the SNOMED codes, because we know that there are some 80 odd carer codes that are being used, which is why NHS England produced some guidance to try and get some consistency in that data. But I think there's something there also about continuing to and the need to keep plugging that and actually having someone drive that. So yeah, lots of, again, really rich stuff from Harcrim to unpick there and include in our report. Is there anyone else, and you're doing so well, because I know this is such a marathon and there's so much to think about, but is there anyone else who wants to contribute?
Emily's got a hand up.
Emily. Oh, Emily Hansenholzen. Oh, lovely. I didn't know Emily was here. How fabulous.
I was. I'm ever so sorry. I've been doing a bit of a hokey cokey. It's because I blame Carers Week. It's just
well, it's lovely to have you join us, Emily.
It's been so fascinating, and I think, you know, I think everybody on this call finds these really useful as well, don't they, with sharing different practice. And I just wanted to share as well a piece of work, bit of work we're doing, which is part of the Health and Wellbeing Alliance with Carers Trust. So Carers Trust is doing a separate bit of work, and stop me when I start to talk about that. I just want you to stop me in case somebody's already talked about it. But the first bit of work really is to look at carer engagement with the ICS. And to really dig down into the guidance, you know, what would we expect to be happening? What kind of engagement would we expect, with some examples of good engagement, and like you were talking about, Rachel, the importance of the JSNA, you know, where does your data come from, where your needs come from, where are you know, Harkaran is just wonderful to hear you talking about GP patient survey states, ASCOF, you know, pulling this all together, because if the ICS is not using that data, what are they using? You know, where do we start falling foul of the law and the guidance? And because Andy popped something in about young carers as well, so we'll slip something in about young carers. It's not strictly about all of that, but obviously that's the whole issue we could unpack, and it's helpful, or Andy could certainly unpack. So that piece of work has to be delivered by the end of March, but just really interested in where people are up to with ICS engagement, which is really important. So we're going to start writing some of that up pretty shortly. So if people wanted to, I might get in touch with some of you via Janet and Debbie, just to see where things are at, and how in those areas who are struggling, you know, how can we help them, how can we give them the levers to get engaged. And then the piece of work that Carers Trust are leading through Ramsey is around contingency planning for the Health and Wellbeing Alliance. Obviously that fits with SNOMED codes, with the stuff that Verity has been talking about, and I don't know whether that's been raised already. Debbie and Janet, stop me if it has. You can wave at me. I can see Janet, can't see Debbie. But looking at good practice around that, and I think we've always got commissioning in our minds, always.
Emily, I will just jump in here, because it's an opportunity also to share a brief update with other colleagues who have lasted the distance on this very long roundtable, and you're all going to get medals and a Mars bar, a virtual Mars bar it will be, but anyway, there is regionally a lot of work now going on around how we embed carer contingency plan in the universal care plan in London, and it's a game changer, because it will mean that every patient who is offered a universal care plan will be asked whether they have a carer. They won't be asked in that term, but effectively that will be a core data capture, and once that's been established, they will look at whether there is a carer support plan in place for the carer, and a carer contingency plan. And I'm privileged to work with colleagues, many on this call, who we operate a task group, who are defining the boundaries and the parameters of what we need to share in that data. And it goes right back to exactly what Ishmael was saying at the beginning, the need to be able to share data across our health and care system, so it can be used in a proactive way to support carers, in this case in emergency. So that is something that we, in terms of the timeline, we will soon be going out to recruit carers into that piece of work, so that they can really help shape the universal care plan, carer contingency plan components. And I think for me, some of this is about scale. So we know that in London, since they launched the Universal Care Plan last year, there's some 60,000 care plans have been introduced into the sort of digital airways, which is fantastic. So if you think once we've got that carer contingency plan in place, that will mean, if they do another 60,000 by the end of next year, every single one of them will have had an opportunity to think carer in them. And that's why I think it's a game changer. Verity wouldn't want me not to miss saying that even more exciting, and nothing to do with me whatsoever, so I can't take any kudos for this, but our wonderful team at the Universal Care Plan have arrangements with the NHS app to integrate the London Universal Care Plan in the NHS app after September. So that will mean in the future we'll get carer contingency planning on the NHS app by the back door. So again, some real potential game-changing stuff there. And I think digital is an area I've read in some of the strategies where they've said they want to concentrate work on to improve support for carers. And I think sharing data is going to be really important. So I just quickly jumped on that one, and I'll now push myself to the back of the queue and hand over to Janet to see if there's anyone else who wanted to say anything about people at the heart of care before we move on to our final section.
There's no hands up as yet, but whilst I wait and see if anyone jumps in, just a couple of things in the chat. Yeah, Wandsworth have asked about SNOMED codes and have been told they've been circulated. Verity's mentioned about sharing twice in the primary care bulletin, but also keep pushing. And a good point about needing to think we need to empower carers, like with the discharge toolkit. So I think we've had some discussions around letters that we can send out via carer organisations that carers can then take into their GPs with the SNOMED code. So I think there's different ways for us to do that. And I think some of this work on the universal care plans and the care and contingency plan, I think, will prompt that as we move forward. David's unfortunately had to leave us, Bromley, but he meant to mention that the local borough, Bromley, have asked us to nominate a carer for the Health and Wellbeing Board. So message is getting through. Yeah, I think that's it. And oh, no other hands have come up yet. So
thank you. Thank you very much, Janet, and especially for your seamless managing of the chat box, which also I can't see. So this is, I suspect this is a very short section, and hopefully we've given you an opportunity to really have a voice here in today's roundtable. But we do want to hear, and this wasn't on the original spreadsheet. This was something that you proposed that we include as part of our wider stock take report. So we wanted to hear from anyone in terms of expert partners and stakeholders' needs. For example, Carers Trust, who are the majority provider here in the London region. So very much looking at their expertise and also what their needs might be, and also any other points, because we realise even with the best designed spreadsheet in all the world, and Iglona did put us on the naughty step for that, there'll be things we've missed. So here is your opportunity to share with us any other points that you feel are relevant, that we and your voice, your opportunity to have your voice heard in the report writing. Over to Janet, who will open the floor up. Has Graham left, or shall I not pick on him anymore?
Graham is still here. He hasn't got his hand up yet,
Graham!
but it looks like he's going to the button. The floor is open to anyone.
Hi, Debbie. Just from me, Kieran here. I don't know if you can see me. It may sound a bit of a daft question. It might be answered somewhere else. But obviously, my thoughts are around, you know, the uplift that you get from the BCF at the moment for carer services. One of the things that comes to mind, obviously, I'm just thinking it locally, being in there and what I'm assessing or what I feel. Is there a way of knowing how they're going to better spend that money on carer services going forward? And it's not what, I don't know if it happens everywhere else, and I can't be sure for Hounds, actually, I'm not speaking, but it runs the risk of being spent, should I say, somewhere else and not directly reflecting the outcomes for carers on a carer specific service.
Do you know that is such an important point that you raise there, Harkham. I've always found the Better Care Fund a bit of a dark art,
Yeah.
and the, you know, the transparency behind it has clearly been raised in the sense that we now have a proper, well, an assurance process for carers and Better Care Fund. I have anecdotal evidence that I think that fund, in terms of what it supports, what it does or purports to support carers, it is diminishing. And that's why we need that year on year data, so we can actually start tracking that spend. Emily will tell me that in the guidance it doesn't talk about any percentage for carers, and there's no ring fencing for carers. I'm going to, with my very long memory here, remind people of pre Better Care Fund days, when funding was provided by government to both local authority and NHS, and certainly under the Next Steps Carers Strategy, the National Carers Strategy, PCTs back in 2011 were given £400 million to buy or purchase carer break services for carers. I would really love to see, and maybe it's just my own personal crusade here, but I would really love to see how much of that 400 million is now spent on carer breaks, and that's going to take someone on a much higher pay grade than I am to get that together. But I think it's important, and I absolutely think the assurance process is the way to go forward with this, so that we can give it that scrutiny, Harkram. Thank you.
Thank you for that.
Great. Oh, we've got a wealth of hands up now. So we've got.
I've really tipped them over at the last.
It's the hot topic. So we've got Eglona, then Graham, and then Emily.
In fairness, my hand was up beforehand, but it was the respite and breaks I wanted to talk about, to mention, because I was really interested when Sarah Hartland's talked about respite monies going to GPs. And I'd really love to know more about that, but I didn't get the opportunity to ask before she had to rush off. Because I certainly know from the London regional meetings, Carers Trust, that the regulated service providers are really, really struggling with, you know, the fact that they've got to pay, you know, the London living wage, and that's not, you know, getting that sort of money. So it's just really difficult to see how any sort of respite is. I know it's not health related necessarily in some respects, but yeah.
Igliana, I can quickly come back on that, so we can have a side conversation off screen to talk about the GP carer breaks funding, which is actually something that came from that 2011 payment to PCTs, and it's been something that Surrey has continued to commission as personal health budgets for carers since over 10 years, but and it uses Better Care Fund money to deliver that. So I think we can have a side chat about that at a time convenient to you. Thank you.
Thanks, Debbie.
Graham?
Oh, thank you. I was just really thinking about the census data, which is showing a drop in carers, and my local authority is already using that as, oh, well, there's been a drop of carers in the borough. from an estimated 25,000 to 19,000, which is a big drop. Now, I know that Carers UK and Carers Trust, when they've been speaking about the data, I said there's some caveats there and we need to be thinking about it. But I suppose I'm slightly worried that if the census is showing a drop in carers, then will that be an excuse to say, oh, are they a priority? But secondly, I think, okay, well, the census is a census, no matter how we may disagree with some of the findings because of the various caveats when it was held and that sort of thing. What we are seeing, which I think we need to focus on, is okay, carers from the census has fallen apparently, but the level of need has definitely increased, and I think that is what we should be focusing on, because we do the carers needs assessments at Tower Hamlets, and whereas sort of 2 or 3 years ago, the highest level of need was maybe 30% of our cases, that's now more 55% of our cases. So that is independent data, independent assessments where we're seeing the need greater. So I think for us, it's thinking when we're looking at the carers as a population, if there is a pushback going, oh well, carers have fallen, there are not so many of them now. Actually, their needs and their support needs are increasing.
Yeah,
I'm just wondering how we capture that. Sorry.
No, I think you're absolutely right, Graham, and that was my fear when the census data was shared, and I agree. There are people on this call who have far better knowledge and have interrogated that data than I have, and you're right. It's a number versus intensity. But what I say when asked about this, quizzed about this, is the ONS data will always be an important source for data, for carer data, but it's not the only one. And I actually think the GP patient survey is far more interesting. So in London, the census data had us at about 7%, but actually the GP patient survey had it more around 16%. So I guess we're somewhere in between those, and actually the numbers in many ways are still massive, whether you go 7% or 16%. So yeah, I think you make a really important point though about how that information is being received in terms of commissioning intentions, and it's a risk, isn't it?
Great. So we've got Emily and then Rachel.
Thank you, Janet. Oh my goodness, Graham, you hit the nail on the head. The key is to talk about the intensity. There has been an absolute increase, not just a percentage increase, an absolute increase in statistical terms in the number of people who are providing substantial care. So if you wanted to say about need, you could, for example, do funding per head compared with 2011 figures and funding per head of 2021 figures of those providing over 20 hours of care in your locality, and that will probably deliver a lower figure per head combined with your 50% of need. You've got one going in one direction, one going in another direction. That'll give you your answer. And if commissioners don't listen to that, that's a problem, I think. That's why I think, Rachel's point about the JSNA is actually really, really important, because it needs to be landed. If we look at carers allowance figures, for example, they've been more or less chugging along at the same level. They've just gone up a bit again. So we've had them sort of static for about the last 2 years, which has been a bit of a surprise, but they've gone up again. And so I think that is quite important. And Debs, if I come back to a bit of a technical thing, what's really interesting is the census stats give us as a percentage of the whole population. That's why 7% feels really quite low, but that includes our children too. That includes kids. So whereas the GP patient survey, is it 16 and up? It's
Yes.
not 18 and up, is it?
It's
so
16.
It's a different population base. So if we took that base for the census, it would be a higher percentage. So sometimes talking in absolute numbers is a bit easier for people to understand. I just wanted to come back to the BCF, because a national level, there's I forget the exact amount, sort of notional amount, if you like, nationally for last year, but I've got a feeling it's about 293 million for carers breaks and carers services, and this year it's supposed to be 327. So that's approximately an uplift of about 10%. So I would have thought, now they, whatever formula they're using locally, but you know, if that 10% is coming through, you might say, oh, well, there's been a 10% uplift in prices and wages, etc., etc. So you don't actually see that being passed on. But a bit of a rule of thumb, you might want to apply that locally to see what funding is coming through. So I hope that's helpful.
Yeah, hugely helpful. And I think partly also, Emily, I think it's the transparency of this funding and
always.
And actually being able to
decades long
to penetrate it and make those comparisons too, because they still feel that they lack some of the strategic overview that you know, has been described in this roundtable and articulated by people who are here. Yeah, very helpful.
Brilliant, thank you. Rachel.
Hi, just to round off with a snapshot from Sutton on this lower number of carers, increased intensity and so on. So as CEO, I was just kind of curious about that locally. So had a little chat with some carers, as we often do, spoke with my staff and what their sense was, excuse me, and then I tried to triangulate that by interrogating just a little bit of the data that we had. And interestingly enough, the stories that came out very much pointed to the additional stress that's come from the public sector failures. So for instance, if you're caring, obviously the strikes that are happening with health service colleagues, excuse me, more difficult to get your kid to school, get on a bus, all those sorts of things impact people. And because of the contraction of the public sector, you know, resources, we spend the first bit of contact often with a lot of our carers, just helping them to negotiate or navigate the system and deal with frustrations around getting hold of people, getting information and so on. Then when I looked at my numbers, which I was doing as part of my Carers Trust National Survey that I do each year, as we partners do, and I've got a new number. The volume or the number of interventions per carer has gone up by 29% in my organization for adult carers. So that's a real number and that's in our preventative support service, which is part of our Care Act delivery. And that is the part of the service that deals with carer well-being in particular as well. These are correlations and they're numbers that stand on their own, but they certainly give us a picture. And then when I was looking at our advice and information service, which again is part of our Care Act duties and separately, but linked in terms of commissioning, we found that the number of queries that were categorized per carer, both adult and young carers, had also gone up. That was not as quantifiable. I'm looking into that further, but the 29% in the number of interventions per carer in our support service, I think, is significant. Coupled with that, the level of expertise required in the team to deal with that increased volume was also greater. So more case discussions, frequency of case discussions involving the whole team, i.e. someone who's got more experience around safeguarding, people who have more corporate memory, more people who understand about the changes in legislation and so on, were also required. So I just thought I would share those little snapshots. And the reason they're on the tip of my tongue is that I have a board meeting this evening, because that's what I'm taking forward to our carer-led board to look into, and some of the staff and carers are coming to present. It's a long day, but a good one.
Yeah, Rachel, it really is a long day, and you're turbocharged as always, which is always fantastic because it energizes us all. Rachel, would we have permission to share that number? Yeah, so we could include that in the report, because I think that's a really helpful statistic. Yeah. Okay.
And even if it's just a case example in an area, I think it still gives a good insight, doesn't it?
Yeah, I very valuable, and again to colleagues on this call who we've got to round up now, but if there are things like as Rachel has just shared that you think you would like to see in this report, this is your opportunity. You know, we are there to help facilitate your voice being heard in the strategic leadership's ears. So you know, let us help do that for you. So I'm going to you'll be very pleased. I'm just going to just cover some of the next steps. It's been a magnificent discussion, and thank you so much for your generous contribution. So we've got some rich data and information from you, and it is our intention to anonymize that data unless you tell others otherwise, like Rachel has just provided some consent there. And the idea is as I said at the beginning, we will provide the spreadsheet report to our colleagues at in the national team for the next oversight board. But I think we always wanted to make more of it than that, and to see how what is the state of care in London for carers at the moment. So to really 1 year on from the Health and Care Act, let's see where we are, and I think, you know, the intention will be that Janet and I will prepare a draft of the report. And if you could share with us, if it is, I know some of you have already returned to me and Janet your spreadsheets, and some who aren't on the call today have returned some. But if you haven't had your chance yet, please could you get them to us by Friday, because we are against a very tight deadline for our national team's reporting requirements. And if you could also share any more recently links to your current local carers strategy, that would just help save a lot of time from Janet and I. And also your carer contingency plan. I did a stock take last year, but I appreciate much will have changed since then. So that's our ask of you, our final ask. And then the intention, as I say, National Oversight Board in July, but we will be using this report and sharing it with all partners, including ADAS London Carers Network. We will share it obviously with our ICS carer leads and through the carer trust partnership that Janet facilitates, and it will be there. It'll be for you to use also. So I think the next steps, as I say, we'll draft the report. We will give you an opportunity to look at that draft and to make changes that you see fitting, and we will get this all done, ta-da, within a month. So that's over from me. Over to my lovely friend and co-chair, my wonderful co-chair Janet, to say final bits.
Well, I would just like to say thank you for the rich discussion, for being open to sharing all of that, and for your time. It's been, yeah, it's been a great opportunity to hear some of the stuff, and it's great how conversations have bounced off each other as well. So, yeah, thank you so much for your time. Any additional inputs greatly received, and yeah, it's been great working with you all. So I hope you have a great rest of the day.
Thanks. Bye.
No, thank you so much. It was brilliant.
Thank you very much, everybody.
Thank you very much. Bye all.
Thank
Take
you.
care.
Thank you.
Bye-bye.
Thank you, everyone. I'll stop sharing now, and I'll stop. I can see people. How wonderful. I'll just stop the recording.
Hello,
Thank
Deb.
you. Thank
I'm
you
so
so much.